This conference will now be recorded.
Good morning, everyone. It's going to take just a few seconds here for everyone to enter the meeting and get settled. My name is Melissa Morin. I'm the Public Information Officer for the Whatcom County Health Department. Thanks to you all for taking time to be on this call with us today. We're going to be hearing from Health Department Director Erica Lautenbach and Communicable Disease and Epidemiology Manager Cindy Hollinsworth with some brief updates about our department's COVID-19 response. Just a couple of quick reminders here as we get started. This meeting is being recorded, and the recording will be made available later today on the Whatcom County Government YouTube channel and on the Health Department's COVID landing page. That's at www.whatcomcounty.us/COVID. Currently, all mics are muted and the chat feature is closed. After we've heard from our speakers, we're going to go ahead and open up the chat feature to begin our Q&A session. At that time, we'll ask members of the media to type your name and affiliation into the chat box, and we'll call on you to ask your question. And with that, I'm going to go ahead and turn it over to Erica Lautenbach to get us started.
Thanks, Melissa. Good morning, everyone. Thank you for joining us. I want to talk about, we're going to have a lot of time for questions, but I want to talk about a couple of the strategies that the health department is actively engaged with. Cindy will talk about testing, but I want to talk a bit about that Public Health Advisory Board task force on COVID business support, give you a bit more information about that and what we're thinking, the intended outcomes and goals, as well as the timeline and the application process. So as I talked about last week, and I also talked about at the County Council meeting last week as well, the Public Health Advisory Board is convening a task force to help with technical assistance for businesses so they can reopen safely. And what that will look like is really focused on the infection control and the social distancing measures. It is necessary but not sufficient. And I want to sort of clarify that's the focus. It will be peer-led and peer-organized. It will represent lots of different sectors, but the intended goal and outcome is to give businesses tools so they can implement proper social distancing measures, like some of the measures you've seen in existing stores, the physical barriers between cashiers and patrons, the lines on the floor that show 6 feet of distance, those kinds of things, and also the infection control measures, ensuring that there are proper measures taking place in terms of hand washing and masking if appropriate, et cetera, in order to control infection. We know that as we reopen our economy, there will be greater risk for people as they interact more to contract the virus. And we want to provide, as the health department, we want to provide businesses with that technical support so they can help ensure that their staff and their customers can interact safely. And it's sort of two-pronged, because we know that even if businesses are doing all the right things, if customers come in and they don't exercise proper precautions and social distancing measures, then the whole effort can be sort of defunct. And so our hope is to pair this technical support for businesses with continued education to the public about what we know to be true in terms of infection control and social distancing measures. Continue to share those messages that we've all heard a lot, but continue to need to hear and remember to practice even as we work to reopen our economy. So the health department is creating the conditions by which businesses can reopen with safety measures, but like I said, this is necessary but not sufficient. And I want to clarify our role versus the broader economic development role, because they are distinctly different. we are creating those conditions, but what's missing is creating the climate for economic recovery, marketing some of the safety measures that businesses are putting into place, and providing businesses with support from an economic perspective rather than a technical assistance perspective. So that's the sort of dividing lines. We are really focused on that operational piece. And the broader economic development efforts are focused on really thinking about what does recovery look like. And the health department is aligning our efforts, but we are not controlling or leading those efforts. That is still the work of Don Goldberg and the economic development team at Whatcom County. So just to clarify those. So in terms of next steps for the task force, the subgroup of the task force is meeting to finalize an application for the task force members. We are meeting this afternoon to do that. We are also meeting to refine our goals and objectives and to set a timeline by which we will execute this process. We understand that there is a great deal of urgency around this, given that just on Friday, the construction industry was given the green light to move forward with projects that have already begun, given implementation of safety measures. So this will continue to happen, and we want to make sure that businesses are prepared and feel confident that they can reopen safely. So there is a great deal of urgency to move quickly and to create a good process in this where lots of different sectors are involved, engaged, and feel as though they have the tools that they need. And I just, for technical purposes, I just want you to be aware that the Public Health Advisory Board has a webpage within Whatcom County's website. We are creating, and we'll have that up and running tomorrow, we are creating a subpage within that Public Health Advisory Board page that will have the application, will have meeting information and the recordings of the meetings as well as notes. So that will all be available on that page, and we will provide a link to that page as well from the Whatcom County Health Department website. So just for functional purposes, that's where you can find all of the information. You can also sign up to receive notifications of the meetings when they are scheduled. And I anticipate these will be scheduled very regularly. So that will be something that we will push out once you're subscribed to that list, like there are subscriptions to all the other lists on the Whatcom County webpage. So with that, a bit more information about what we're thinking and what we're planning, and I will turn it now over to Cindy to talk about testing. Cindy Hollinsworth, our Communicable Disease and Epidemiology Manager at the Health Department.
Good morning, everyone. Last week, we let you know that we're in good shape when it comes to our current capacity for testing in Whatcom County. We're continuing to monitor testing capacity as we check in with our healthcare partners through weekly healthcare coalition calls led by our Deputy Health Officer. And on these calls, we're checking in about several components of testing, specimen collection, which requires both adequate PPE and test swabs, and also processing the specimens, which could be on a rapid test machine or by sending to a lab for processing. So currently, there are at least 9 sites available for specimen collection in our county. These are clinical sites, such as drive-through testing sites run by healthcare organizations, where healthcare workers collect a specimen from individuals who need to be tested. We estimate that right now, among all these sites, up to 2,400 specimens could be collected weekly, and our clinical partners have the capacity to scale up and scale back on those services as needed. We also have capacity to run at least 10 times that many tests each week in Whatcom County, and this includes processing through local labs as well as the state public health lab. Even as we relax social distancing restrictions and begin to see an expected increase in infections, we believe we are currently well equipped to handle the number of tests that will be required. With our current resources, we can meet our goal that people with symptoms are able to get tested the same day or within a day after their symptoms emerge and get test results back within 1 or 2 days, or in some cases, even hours. This quick turnaround means that we can ensure that we are able to initiate isolation and begin case and contact investigations quickly. Testing recommendations are changing. Early on in the COVID-19 outbreak, we asked people who were mildly symptomatic to stay home and not get tested. And now that we have increased access to testing, guidance is changing to encourage all people with symptoms to seek screening from their healthcare provider. Our goal is better understanding of the extent of and monitoring the course of the epidemic. Information received from testing allows us to inform community-level disease prevention strategies and also improves the accuracy of forecasting models for acute healthcare system needs. We want to contain outbreaks through identification of those most likely to be positive and following up with isolation of cases and quarantine of their household contacts. There is emerging information that people who don't have symptoms can test positive for COVID-19. In certain circumstances, such as pre-procedure screening or an outbreak investigation, we do test people without symptoms where knowing for sure who is positive for COVID-19 will help us control further infections. There's also been a lot of interest in serology testing or antibody testing. While serology testing holds a lot of potential, it doesn't yet give us the kind of reliable information we need, and more work is needed on this kind of testing in the coming weeks and months. The first and most urgent need is for validation of serology tests. There are dozens of serology tests being marketed in the United States that are not yet providing consistently accurate information and that are not comparable to each other. We simply don't know at this point what the result of those tests are giving, that the results of those tests are giving valid information. And then the second need is a better understanding about what kind of long-term immunity people have to COVID-19. There isn't yet enough scientific information to tell us how long immunity lasts in people who have already been infected. With many diseases, immunity can wane over time for various reasons, and we need to study this more before we can say that an antibody test is proof of immunity to COVID-19 in the long run. So given the inaccuracies in the available serology tests and the uncertainty about how the test results correlate to immunity, serology tests are not yet a good source of information for us to base our public health decisions on. We're also cautioning people against interpreting antibody test results to tell them if they are safe from getting sick again. There's still a lot to learn about what these tests really tell us. We're continuing to monitor this emerging science with hope and caution. Once we do have valid, accurate serology testing that is widely available, it will give us important benefits. We will be able to monitor the prevalence of prior infection and immunity in our community, and results can be used to provide guidance for staff and patients in settings where transmission is occurring. Even with all of these pieces in place in terms of our testing and contact investigation capacity, it's reasonable to anticipate that COVID-19 transmission will increase as we dial back social distancing measures. Our community should be prepared to see case counts rise again and know that we will have to remain flexible and ready to respond should we need to re-escalate distancing measures at one or more points in time in the next year or two as we wait for a vaccine to emerge. We'll have to learn new practices as we return back to our old routines, just as we've learned to wear masks and stay 6 feet away from others over the past 2 months. More exactly about what this will look like will be forthcoming from our state leaders and at the local level from our task force that Erica mentioned. Some of the things we can probably expect to see are strict isolation and quarantine for individuals suspected or confirmed to have COVID-19, employer-based infection prevention plans that include symptom monitoring for employees at their workplace, and continued teleworking for those who are able, continued distance learning, and continuing to stay at least 6 feet away from others. Of course, the success of these interventions is dependent on all of us, also washing our hands thoroughly and frequently, using hand sanitizer when we can't wash our hands, and being sure to stay home when we are feeling sick, even just a little bit sick. So with that, I'll turn this back over to Erica.
Thanks, Cindy. We've talked a lot about how we're all in this together. And that's true. This virus is really showing us that we're all connected. So for our community to stay healthy, we all have to do what it takes to stay healthy and prevent the virus from spreading to others. But this virus has also taught us that even though we're in this together, we aren't all experiencing it in the same way. We're still learning about the disproportionate effects of COVID-19. We're learning about the health of communities of color in terms of COVID-19. And according to the CDC, current data suggests that people of color are more likely to get sick and die of COVID-19. In fact, a recent CDC report showed that not only did hospitalization risk increase with age, as we have seen in our community, but African Americans with COVID-19 are also more likely to be hospitalized. Statewide, I was on a call with our State Department of Health yesterday, and they shared that among the tests that had race ethnicity data, Hispanic and Latinos represented 13% of the population, but 28% of positive cases and 21% of hospitalizations. And likewise, African Americans are disproportionately impacted. They represent 7% of positive cases in Washington state, but 4% of the population. So we know that by virtue of being in public more often, the risk of getting COVID may be higher for essential workers who are not able to stay home. The likelihood of a person being employed in a job that is considered essential varies by race and ethnicity. For example, according to the CDC, Latino workers account for 17% of total employment, but comprise 53% of agricultural workers. And African Americans make up 12% of all employed workers, but account for 30% of licensed practical and licensed vocational nurses. So in the short term, it's important for us to consider that our actions contribute toward protecting everyone, especially those who are at greater risk because of their age, occupation, genetics, race, or socioeconomic status. And in the long term, we need to make sure that everyone in our community is able to go to the doctor when they are sick, that everyone has the opportunity to stay home when they are sick, that everyone has a place to wash their hands. We need to make sure that everyone can get good food to eat and have a warm place to sleep. And that's the work of public health and the work of understanding that we are all in this together, and taking care of the people around us is as part of taking care of ourselves too. I want to appreciate and just call out some of the great efforts our community is undertaking to make sure that the social supports are in place. I know the Whatcom Community Foundation has taken a real leadership role in ensuring that our food systems remain strong, especially for our food banks, and has really worked to try to pay mind and highlight the disproportionate impacts that this disease is having on different populations. And that is public health work. It is our social services work. And we're proud to be in a community that is thinking about this and tending to this. But in the long term, we'll need to keep that in mind and make sure that we support all of us as we are all in this together.
Thank you, Cindy and Erica. We've opened up the chat feature, so if any members of the media have questions they would like to ask, please go ahead and type your name and affiliation into the chat box. Okay, it looks like our first question is from Denver Pratt with the Bellingham Herald. Denver, go ahead.
Hi guys, yeah, thanks for taking my question. Do we collect race and ethnicity data for our tests locally? And if so, can you tell us what percentage those make up of our positive cases and our deaths?
We do collect that information, and that's generally through the case investigation interview. And I don't have the immediate numbers in front of me. I do know that there was a discussion on a state phone call within the last couple of days about also looking at separating the cases that are happening in our long-term care facilities, which are primarily older and white, and looking at looking at the sets of data separately.
Our next question is from Joe with KGMI. Joe, go ahead and ask your question.
Thanks very much. Concerning testing, I've seen anecdotally people saying they've requested tests a time or two or more from their provider. They've been refused. And Cindy, you said that testing's been expanded quite a bit here locally. And so if someone is symptomatic, can they get a test at this point? Are providers still holding back a bit? What can someone expect to say they've got a sore throat, or they just have some sort of symptoms? Will they be able to get a test?
Yeah, that's the part where I was saying that our the testing guidance is actually changing. Like as we speak, we're hoping for our updated guidance from the State Department of Health, which is also reflecting the CDC guidance that includes the additional milder symptoms, and then also encourages and gives providers guidance to test people, because originally we had only been saying we're going to test you if you're in a priority group, right? You're a healthcare worker, you're an essential personnel. But so that with this next round of guidance, that'll be opening up, and I think providers. We'll be doing a health alert for providers, asking them to and letting them know about that updated guidance.
Our next question is from Robert Mittendorf with the Bellingham Herald. Robert, go ahead. Robert, if you're on the call, go ahead and unmute yourself to ask your question.
Hi, sorry about that. Thank you. I actually have a couple questions, if you don't mind. You were talking about expanding the testing a little bit for anyone who's showing symptoms can now contact their doctors. I'm wondering, since a lot of the research is showing that people can have symptoms for several days, or even only show mild symptoms, when are we going to get widespread testing without symptoms, testing on demand? And to follow that up, there's been a lot of talk this week about contact tracing and how labor intensive that is. Some nations have been using cell phones, mobile phone contact tracing to send text alerts to people who were near folks who have tested positive, and I was wondering if we'd considered using that. Thank you.
So the first question was about testing on demand for asymptomatic persons. We will do that. We will test asymptomatic people in the course of a case and contact investigation related to an outbreak. But that's not currently the guidance that we're following at this time, just for anyone in terms of, just anyone being able to walk in and get a test. And that's not to say that providers can't test whoever they want. They can approve testing. That's been very open for quite some time, but because of organizational access to testing, that's been a little, it's been held back a little bit. Some organizations, because they have had limited testing, have said, well, we're also going to follow the public health testing criteria, which is the high priority groups. So now that that's all freeing up, that we are seeing increased access to testing and supplies and faster processing time, I think, as with the rest of the response, we're seeing changes happening quickly. In terms of the contact tracing, we are working closely with the State Department of Health on a integrated statewide plan for using the same system across the state to do our contact tracing, which does not include using cell phone data to track where people have been.
Our next question is from Key Relia with the Bellingham Herald. Key, go ahead.
Hi, yes, thanks for holding this briefing today. I had two questions. One is about the race and ethnicity information. I was wondering if you are going to post that at some point on the Whatcom County Health website, since the state does that on its website regarding, tracking COVID-19. And the other question I had is regarding testing. Do you expect that with, I know that the discussion has long been that any healthcare provider can offer or have someone tested if they wanted to, but what I've heard from people is that they are pretty much following the health department's guidance on that. So do you expect that with your change in the guidance that perhaps more healthcare providers will order tests for people? That's it. Thank you.
Yeah, so the race and ethnicity information, we're always assessing what data we have available to us and then looking at data standards for publishing. We have to be careful when numbers are too small that we could unintentionally identify a person or release something that could be considered private health information. But this, yes, we are assessing what's going to be what we're going to post on the website, which I imagine as our numbers grow at some point, we'll have numbers to be able to do the race and ethnicity information. And in terms of the testing changing guidance, I do think that most of our healthcare providers or, our system here in Whatcom County and across the state understand that we're going to have to be doing intentional early testing if we're going to control the infection going forward as we loosen up the social distancing guidance.
Our next question is from Pat Grubb with the All Point Bulletin and the Northern Light. Pat, go ahead. Pat, if you're still on the call, you can go ahead and unmute yourself and ask your question. We'll go ahead and move on to Denver Pratt with the Bellingham Herald. Denver, go ahead.
Hi, yeah, we've been seeing some things that people are, not seeking care for things that are unrelated for COVID. And I was wondering if you guys have been hearing the same thing, if that's happening here locally as well.
No, Denver, this is Cindy. I don't have any information about that locally. I haven't, not aware of any reports.
Our next question is from Oliver Lazenby with the Northern Light. Oliver, go ahead.
Hi, thank you. My question is about test kits. The governor said last week that a lack of test kits is an obstacle for the state in easing restrictions. And Cindy, if I understand what you said, it doesn't sound like that's the case locally. So where are our medical providers getting test kits, and why is that not an issue here?
Our local labs are able to provide our healthcare providers with kits, and they state to us that they have good supply source. And that's about all I know about that information or where they're getting it. I do also know that the state public health lab supplies are going to be moved to a more centralized process out of Tumwater through the unified command request process. And so that's for priority populations that qualify for testing at the state public health lab.
We've got another question from Robert Mittendorf with the Bellingham Herald. Robert, go ahead.
Hi, thanks again. There was some news stories in the past week or so that doctors have been finding some unusual results of COVID infection, including clotting and strokes, especially among younger people. I know that looks like we haven't had a death younger than 60 here in Whatcom County from COVID-19, but have doctors here reported that same occurrence of clotting or small clots, especially in the lungs, or strokes caused by this?
I'm not aware of that, any reports of that nature here locally.
All right, Pat Grubb, let's go ahead and try again with your microphone.
Hi there, can you hear me now?
We can, thank you.
Oh, okay, I don't know what happened. Going back to the criteria, there's a huge proportion of people who test positive for COVID-19 yet show no symptoms. And it seems to be a broad consensus that before the economy can be successfully be reopened, that there has to be mass testing of the population. So on Friday, I calculated that Whatcom County has tested 0.8% of the population. The state has tested almost 2%, and Snohomish is over 2%. So I'm curious about where this guidance is coming from, that we're still testing such a limited amount of number of people. And the other question I'd like to know is, there's numerous reports about various locations having a much greater increase in the rate of death than historical averages would indicate. They're not necessarily attributed to COVID-19, but do we have comparable figures for Whatcom County? Hello?
Yeah, sorry, so the two-part question now, I was trying to remember the first part.
Okay.
So the first part around testing guidance, you know, anyone can get tested, and there is sufficient testing capacity in our community. And we are also here at the health department able to test those who cannot get tested by their healthcare provider or don't have insurance. And we're just not aware of reports of people that are requesting testing and unable to access that. So, and I don't remember exactly what the specific question was around testing, but I'm happy to get more specific. And I'm not sure, could you repeat the question about death rates?
Various cities, New York, around the world, their death rates, weekly average death rates, has increased tremendously. Not all of it is attributed to COVID-19. It could be people who they have heart attacks or something and didn't go to the hospital, but it's like up to twice the normal rate of death for this time of year. Do we have comparable figures in Whatcom County, i.e. how many people one would expect to die in a week in Whatcom County this year versus other years of all causes?
No, I'm not aware of that, but yeah, no information on that.
Okay, but I did ask, the testing rate in Whatcom County is 0.8% versus almost 2% for the state. So why are we testing such a low number?
It's really about people reaching out to their healthcare provider and asking for testing through their healthcare provider. So for whatever reason, either people aren't sick, they don't think they're symptomatic, and they're not accessing. So either we don't have, people either aren't, yeah, they're either not symptomatic or they're not seeking care.
Other jurisdictions have done random testing to get an idea of the extent of the infection rate. Has Whatcom County considered doing that?
At this time, we're doing testing in outbreak situations, and so that, like around our care facilities, that might be that's a place where we would go in and test the population of people living there to see what the infection rate is within the facility. So that's our approach at this time.
And I just want to be clear that the health department is testing with our public health surveillance and outbreak standards. So really thinking about how we test for those that have been identified as exposed by cases in our case investigation process, and those outbreaks, like Cindy mentioned. We really rely, because of our staffing levels and our ability to do that work, we really rely on our healthcare providers to pick up the balance of the testing that's occurring in Whatcom County. So when we say we're talking about the whole healthcare system, not just the health department.
Our next question is from Joe Tehan with KGMI. Joe, go ahead and ask your question.
Thank you. I wanted to ask, with pushback against the governor's stay home, stay healthy plan or order, is seemingly increasing. It seems like out on the streets today, there's more activity. I see more work trucks out. With this frustration that's building with people, weeks in isolation and with economic difficulties, I guess I just wanted to get your reaction, maybe Erica specifically, to people pushing back against this, pushing back against isolation, social distancing, and is there worry, I guess?
I think in some ways we're a victim of our own success. We have really seen the numbers come down statewide and in Whatcom County due to these measures. And if I could speculate, I do think that there is a different perceived risk about exposure now than there was when the stay home, stay healthy order was put into place. I do, anecdotally, I have talked to others, and we've all seen more people on the roads, at stores, grocery shopping, etc. And that is a concern. That is a concern because we need to make sure that, we're really focused on preventing a second peak or a second high peak. And we know we need to work with the business community, as we are with the task force, to help businesses reopen safely. We know that these things are coming. And in the meantime, we need to do that planning and prep work so those businesses are prepared and that people feel as though they have the education necessary to interact and do commerce in a way that they can keep themselves safe. And that is in conflict with the lowered perceived risk that I see just anecdotally out in the world. And the reports about asymptomatic, lots of cases of asymptomatic disease. So yes, these are realities that we're all seeing and we're all facing, and we're really focused on, again, that testing, the case investigations, and helping businesses reopen safely with infection control and social distancing measures, and then making sure we continue to educate, to push the messages to the community about the importance of social distancing and taking infection control measures, the hand washing and not touching your face, masking, etc. So we are trying to push those messages, and we recognize that this is not a Whatcom County issue. This is a Washington State issue. This is a United States of America issue. So this is something that health departments all over the country are starting to see and starting to face and try to address in a way that that really sort of balances the need to reopen the economy with the need to control the further spread of this disease.
Our next question is from Ron Judd with the Seattle Times. Ron, go ahead.
Good morning. Yes, I noticed that Shuckson Healthcare Center is starting to accept additional patients who are tested COVID positive, and I'm assuming that's being done in conjunction with the health department, with you folks. And what I'm wondering is, A, is that true? And B, is there a process by which other skilled nursing facilities or other isolation facilities of that kind might be authorized to do the same thing in the future?
Yeah, Shuckson's really stepped up. They're one of 3, I think, facilities statewide who are skilled nursing facilities who are accepting COVID positive admissions from other facilities, whether it's the hospital or the nursing home, other nursing homes. So, I believe at this point they've accepted 2 admissions from the hospital. We're working closely with them on how they are admitting people, what wing they're using, how their staff are working between the units of people who've been currently infected versus previously infected or negative. So lots of close work with us there at the health department level. And part of what we're doing with the numbers is continuing to monitor the need for surge facilities and what those will look like here in our community.
We have 2 more questions in the queue. We'll go ahead and end after those 2 questions. The next one is from Denver Pratt with the Bellingham Herald. Denver, go ahead.
Hi, yeah, thank you. I was wondering what the number of skilled nursing facilities is here in Whatcom County that have confirmed positive cases.
Yeah, we have 9 skilled nursing facilities in Whatcom County, and 2 of them have confirmed positive cases of residents.
All right, our last question is from Key Relia with the Bellingham Herald. Key, go ahead.
Hi, thanks again. This is again related to testing. I just wanted clarification. The Washington Disease Reporting System, does that capture all of the tests that have been conducted, or only the tests through UW and the State Public Health Lab?
Oh, sure. The Washington Disease Reporting System is our system that we use for any positive results. So wherever they're done at, some labs upload those results electronically right into the system. So when we log in, we can see them in there. And other labs that are newer maybe and don't have that electronic reporting in place, they fax results here to us at the local health department. And then we data entry those and start the case and contact investigation at that point. And then the system did become overwhelmed because we don't normally count negative results. And so over the last couple of weeks, the State Department of Health has shifted negative results to another system so that we'll have a good denominator about who we've been testing and the % of people getting tested in each community.
Sorry, just as a follow-up, Cindy, just so I'm clear, the systems that are set up right now, are they capturing all the tests that have been done in Whatcom County? Sort of a follow-up on what Pat was asking.
Well, we have a lab here in Whatcom County that's newer to doing testing for COVID, and so they weren't uploading electronically. So we're really working closely with them and the State Department of Health. In fact, over the end of last week, we were doing some trials of electronic batching of results. So we might not be completely up to date. We think we're close, though, on the number of tests run here in Whatcom County, and I think that'll get truer over the next couple days as we get all of their results into the system. I think we're also constantly working with, new new testing sites that are popping up, especially as we have the point of care testing, which is that rapid test where you get your results in 15 minutes. That's a requirement that those places also report both positive and negative test results to the State Department of Health. And so we're listening for those and reaching out to them as we hear about them so that we can make sure they're doing the reporting.
Thank you, Cindy and Erica, and thanks to everyone for attending. And with that, we'll go ahead and end our call for today.